One morning, Phenylephrine woke up early and was feeling grateful because she gets to rest for the weekend. She's a vlogger and today, she feels like live streaming to start off her day.
Hi guys, good morning and welcome to my live stream. I just want to bring you guys along with me on my rest day and
Phenylephrine surprisingly came across a friend's suggestion that is exactly the same as her identity. She clicked that account and voila! A doppelganger as she suspects. She studies through the profile and the personal information are interestingly the same.
wow, that's strange. How do we have a lot of similarities? My heart is pounding so loud I can hear it. I have a feeling she's my long lost twin. I need to talk and verify with her. She could be my sister, right? I can't believe this is happening. I need to know her story, her life, her work, everything. Oh my gosh, should I chat her first or call her right now? Maybe I should just call her. Yeah, that's right. I'll call her. Yep, calling her now.
Uh, Hello?
Apparently, when Phenylephrine 1 answered, she immediately forgot she was live streaming.
Hello? I was just scrolling through Facebook and I came across your profile in my friend suggestion list, and I was wondering if you know me or if it's the other way around.
Wow. How is this happening? I was actually just looking at your Instagram account because you look so familiar and my heart was telling me that I should get to know you. You wouldn't believe me if I say 2 minutes ago I was just about to send you a DM.
OMG, I'm literally having goosebumps right now.
So, allow me to introduce myself. My generic name is Phenylephrine, while in pharmacies I'm known as Sudafed PE, Neosynephrine, Vascolep, Nasib 12, Dimetap, and Triaminic. How about you?
Trust me when I say everything you just told me right now, I sleep and wake up with those names. I am phenylephrine in generic, while in pharmacies, I'm also known as Sudafed PE, Neosynephrine, Vascolep, Nasib 12, Dimetap, and Triaminic. Can you believe that? And my exact molecular name is 31R1-hydroxy-2-methylaminoethyl phenyl. Don't tell me that's yours too.
Okay, I'm literally shaking my head right this second. That's how my molecular name goes as well.
How about your therapeutic effect? Are you a nasal decongestant too?
Exactly the same. Yes, I am a nasal decongestant and my pharmacologic effects are adrenergics and vasopressors.
Wow, those are my pharmacologic effects as well. Alright, let's answer this one in unison. What is your pregnancy category? In 3, 2, 1. C!
Wow, I'm speechless.
So, how do you work?
Well, I basically constrict blood vessels by stimulating alpha adrenergic receptors. I function as an alpha-1 adrenergic agonist that mediates vasoconstriction depending on the route and location of my administration. My chemical composition is similar to epinephrine and ephedrine, and when I'm administered intravenously or applied directly to mucosal membranes, I possess potent vasoconstriction properties. Systemic exposure to me often contributes to alpha-1 adrenergic receptor agonism, raising systolic and diastolic pressure and peripheral vascular resistance. The vagus nerve is activated by elevated blood pressure causing reflex bradycardia. So yeah, that's how I work, and I'm sure it's similar to yours since it's in your Instagram bio.
That is so accurate! Every sentence. And, oh, how about this one? Bet we're alike as well. For my pharmacokinetics, I am readily and completely absorbed when administered orally. My bioavailability is approximately 40% and peak plasma concentration is in 45 minutes to 2 hours. The volume distribution if I am taken orally is 200 to 500 liters. I am rapidly distributed into peripheral tissues. There is minimal penetration into the brain and minimal excretion in breast milk though. During metabolism, I am metabolized in the gut wall and liver via sulfation and glucocoronidation and oxidative domination by monoamine oxidase. Lastly, I am excreted via the kidneys. Effective half-life is 5 minutes while my elimination half-life is 2 to 3 hours following oral administration.
This is getting crazier. How is this possible?
Right?
Okay, for my indications, I am a topical decongestant, and topical decongestants are sympathomimetics, meaning we imitate the effects of the sympathetic nervous system to cause vasoconstriction, leading to decreased edema and inflammation of the nasal membranes. I am also indicated to treat hypotension associated with shock that may persist following adequate fluid replacement. But my usual indication is relieving discomfort of nasal congestion associated with a common cold, sinusitis, and allergic rhinitis, which are available in nasal sprays. I can also be used to promote medical evaluation or to elevate otitis media pain and congestion when dilation of the nares is needed. My contraindications are drug hypersensitivity, severe hypertension, heart diseases, monoamine oxidase inhibitors used in the past 14 days, thyroid disorders, enlarged prostate and urination problems, and acidosis.
Wow. All I can say is that we are very identical. Our indications and contraindications are so much alike. Now for my side and adverse effects in each body system. In the central nervous system, I can cause anxiety, dizziness, headache, insomnia, nervousness, restlessness, trembling, and weakness. In the cardiovascular system, arrhythmias and tachycardia. In the integumentary system, blanching, pallor, piloerection, sweating. In the respiratory system, dyspnea and respiratory distress. In the digestive system, mild upset stomach and intense abdominal pain. In the skeletal system, joint pain. In the muscular system, muscle spasm, muscle pain, and muscle tremors. And in the urinary system, urinary tract infection.
Even on the adverse effects, we're on the same page. Well, actually, we're on the same chapter.
Yes, I couldn't agree more.
Now, let's find out if we're still the exact same on this one, the nursing responsibilities.
Bring it on, girl.
Okay, so prior to administration, the nurse must first educate the patient about the medication, and then instruct the patient to report any adverse reactions, and lastly, she or he must assess the patient for possible contraindications. Now, during administration, when administering through the nasal route, instruct the patient to blow their nose gently to clear nasal passages before administering the medication. For instillation drops, the nurse tilts the patient's head back while sitting or standing up, or hang their head over the side of the bed when laying down. They stay in the same position for a few minutes to spread the medication through the nose. For nasal sprays, they position the patient's head upright, then spritz 1 to 2 sprays firmly to each nostril. They wait for around 3 to 5 minutes, and then they instruct the patient to blow their nose and then repeat the dose. They make sure to rinse the tips or droppers of nasal solution dispensers with hot water to prevent contamination of these solutions. For oral medications, they give it as directed on the label or as prescribed by a physician. They warn the patient not to use it in larger doses, especially when taking on-the-counter medications, since many on-the-counter medications contain the same ingredient, which would possibly lead to overdosage.
OMG, OMG, OMG. Okay, that's exactly what the nurse does to me too. Wow, listening to you feels like I'm listening to the voice of my own head. Allow me to continue with what they do after therapy?
Sure.
After administration, the nurse evaluates the effectiveness of the drug therapy. They monitor breathing patterns and observe for shortness of breath, as we can trigger asthma. They also monitor changes in heart rate and rhythm, elevated temperature, behavioral changes, and chest pain closely for patients with diabetes and hyperthyroidism. For hypotensive patients, they monitor vital signs, including cardiac output.
We have the exact same identity. I feel like you're my duplicate.
Oh my gosh, you're her, aren't you? My twin? My long-lost twin?
Oh my god, I think so! I don't exactly know what happened in the past, but I'm overflowing with joy right now.
Oh my gosh, I can't believe this is really happening! I'm so happy right now, I think I'm gonna explode. Oh, I completely forgot that I was live. Our entire dramatic conversation was witnessed by 13,578 viewers. You know, I've been talking about you in most of my vlogs. Can you please say hi to my live stream?
Hi guys! Finally, it's me, the long lost twin. I hope to get to know you all very soon. Thank you so much for supporting my sister in her vlogs.
Oh, that's so sweet of you, sis. So you heard her, guys. Thank you for all your support all throughout. I'm gonna have to end this live now because my twin and I have a lot of catching up to do. Till next time!